Hi, everyone. I'm Sarah, and part of my therapeutic intervention I'll be focusing on is social learning and cognition with family counseling. And the purpose of this family therapeutic intervention is to help the clients gain new skills and addresses their belief system. Um, and it helps families that are struggling with their roles and troubled relationships they have with one another, and it helps restore any strains that's happening. In regards to counseling, it puts a lot of emphasis on learning, performance of these skills that are related to their beliefs. Um, it's also focusing a lot on self efficacy, which is the belief of, or this self belief of whether or not they're doing it right. So, whatever role they are in the family, if they're being successful or not. It's also replacing dysfunctional belief systems within, whether it's from adaptive or maladaptive behaviors. It's a strength-based approach as well. So therapists usually have this belief that if they learned a negative behavior, they're capable of learning a positive behavior. So um, everybody has this opportunity, or people are able to learn. Um, it also helps them implement new coping skills, and it promotes resiliency. So some of the difference or the separation between social learning and cognitive is cognitive is examining the role or belief system that influence their behavior. So its foundation is focused on family, culture, and individual experiences, whereas the social learning aspect of it is uh, it's derived from the environment and the social context and expectations of that responsibility. So, for instance, uh, there could be adaptive or maladaptive behavior that's learned from the environment. So, for instance, like spanking or corporal punishment, that could be um, a learned behavior. It also social learning also emphasizes this operant conditioning. So a good example of this is Van Hook brought this in her book, and she mentioned that she gave an over-the-counter story. So um, when a child is kind of whining and complaining because they don't get to have their candy bar, positive reinforcement is the parent giving them no, I'm sorry. The positive reinforcement is the child whining and complaining, and then they're receiving that candy. And negative reinforcement is the parents kind of giving in and handing them that candy. So some of the goals of therapy or treatment is promote family functioning, promote motivation, and encourage members to perform that behavior that meets the needs of all the family members. Addresses the belief system that foster effective behavior and the family members that increase positive change. And the role of the therapist is to coach and model positive behavior and provides new skills and helps them modify their cognition and promote learning and performance. So there you have it.